Hello, my name is Jonathan Resnick. I am with FDA in the Center for Drug Evaluation and Research in the Office of Business Informatics. And today I'll be giving an update on the electronic submissions. I'll be talking about electronic submission guidance, mainly about what's new, the purpose of ECTD and study data requirements, CDER processing, a look under the hood, some frequently asked questions to our electronic submissions team, and when to use CDER's new NextGen portal. Our ECTD guidance received an update this past February 2020. This was revision 7, and it contains two important items of note. The first is that Type 3 drug master files have been added to the exemption section of the guidance. The second note is there has been a new section added on waivers to address the types of submissions that may qualify for a long-term or short-term waiver from the ECTD requirement, and it contains instructions on how you would submit that waiver request. We also wanted to point out the study data guidance, providing regulatory submissions in electronic format, standardized study data. It's important that sponsors conform to the standards in the FDA Data Standards Catalog, as that is stated in the study data guidance. Specifically, this is about when a sponsor submits studies to an NDA, a BLA, or an ANDA, where those studies started after December 17, 2016, or if a sponsor has submitted studies to a commercial IND, where those studies started after December 17, 2017. These are really important dates because if your study started after these milestones, you are required to follow the study data guidance and conform to the standards in the FDA Data Standards Catalog. Now, what FDA plans to do is to use ECTD validations, and the specific ones here are 1734, 1735, 1736, and 1789, and we'll be using these validations to automatically confirm if sponsors are conforming to the FDA Data Standards Catalog. So this subset of ECTD validations are described in great detail in the technical rejection criteria for study data. That's a document that my colleague Heather Crandall will be talking about quite a bit here. So it's really important that industry understand how FDA plans to validate that these electronic submissions containing study data are conforming to the study data standards. And the way you can learn about this is by reading up on the technical rejection criteria for study data. This may be, I can't stress enough how important it is to read this document and become familiar with it. And then there's also the Study Data Technical Conformance Guide, and then there's a website on the FDA.gov page called Study Data for Submission to CDER and CBER. Now, the purpose of ECTD validations and study data requirements is that reviewing study data in a timely manner is critical for FDA's review process. For example, reviewers have only 30 days to review an IND application before they need to provide a response. And when sponsors submit data to the FDA in a reliable and accessible format, it then improves the efficiency and consistency of review divisions. The CDER standards enable FDA to streamline the review process. How does it work? Well, it reduces the time for reviewers to locate and identify study data. Reduces the burden on the sponsors and the reviewers from the standpoint of information requests. It reduces the review time by enabling the use of COTS, or commercial off-the-shelf software reviewer tools. These are tools such as JReview, Jump Clinical, and others, which are designed to automate review analyses. This all goes to supporting the data-driven decisions by applying data mining and data analytic techniques. A little more about the Study Data Technical Conformance Guide versus the technical rejection criteria for study data. Now the Study Data Technical Conformance Guide, this provides technical recommendations for submitting study data according to the CDISC standards. The technical rejection criteria for study data provides the conditions under which FDA will not accept submissions with study data. So really, the technical rejection criteria for study data, this is telling you how FDA is using those ECTD validations to check for conformance to the study data rules. This table below, again, shows the 4 ECTD validations that are being used. You can see they're all listed as a high severity level, which means if you were to fail any one of these, it could result in a technical rejection at the gateway. Overall, looking at our electronic submissions coming into CDER, we received approximately 205,000 via the electronic submission gateway in fiscal year 2019. Nearly 202,000 of these were in ECTD. Another way to look at the metrics that come in is the chart on the right. In fiscal year 19, 99% of the regulatory submissions, and these are specific to commercial INDs, NDAs, ANDAs, BLAs, drug master files, which are type 2, 4, and 5, were submitted in ECTD format. It's a nice graph here, and it shows you the progress the industry and FDA have made over the last 10 to 15 years. If you look at 2010, the blue bar shows you that FDA received, or CDER specifically, received about 150,000 submissions that were electronically submitted. But less than half of them were in a standardized format we call ECTD. Fast forward to the end of the last fiscal year, 2019, and CDER received over 200,000 submissions in electronic format, and the format that was used was ECTD, so it was standardized. This helps with automating processing of these submissions and automating and having a standard way for the review offices to view the content of these submissions. Once the submission comes over through the gateway and is made accessible to the document room, we've been working to automate processes for the document room to then make it available to the review offices. Now that we see that nearly all of our submissions are coming in not only electronically, but are coming in with the ECTD standard, we're able to use metadata from the submission to automatically categorize and route it to the correct review office. And the benefit here is the reviewers see the submission sooner, and it's also reduced amount of manual data entry. We do have a few challenges, though, with this automation. To efficiently and effectively process the increased number of submissions and leverage the submitted structure that ECTD and study data have, FDA is in the process of automating the inbound submissions, and we use the structured data from the ECTD backbone files and also the fillable form 356H. But sometimes what we see is that for a given submission, the data submitted in the ECTD backbone files, for example, the US regional, differs from what is provided in the regulatory form, like the 356H. It's okay if it's slightly differs, but if it's two totally different things, the automated software doesn't know what to do with it. It kicks it out and goes into a queue for someone to manually take a look at it, and that slows the processing of the submission down. Another challenge we have is that FDA is set up to use state-of-the-art review tools, and these tools really only work well if the data is submitted in standardized format. And what we're seeing is that despite the guidance that's out there that says you need to be submitting studies in standardized format and following CDISC, many of these submissions are not conforming to this. This slide here we put in here so you can see that the submission types that are used when defining an ECTD submission are listed in a specification, backbone file specification for Module 1. It explains how to build the regulatory activities using Module 1 elements and attributes, such as submission type, submission ID, and submission subtype. We do realize that most of you are using commercial ECTD publishing software, which takes care of this behind the scenes. But for some of you that may not be, or if you want to just have more background on what these different submission types are within the standard, you can look here on our ECTD website. So we have an example here of an ECTD data discrepancy. We call this, can you guess the correct regulatory activity in the submission? So on the top is the metadata provided within the ECTD structure itself. It's called the US regional file. And the second line there gives the submission type of amendment. Now within this submission is also the fillable FDA 356H form. And in field 22, where you would select the submission subtype, for this particular one, initial submission was checked. So on the form, it says initial submission, but in the ECTD backbone, amendment was selected. So this is a case where the automated software simply does not know what to do with it and cannot move forward, so it goes into a queue for manual review. After manually reviewing it, the document room finds out that the submission was actually an amendment containing patent information. So the appropriate submission subtype on Form 356H would have been amendment, not initial submission. So overall, the ECTD data discrepancy impact. So when data is submitted correctly in ECTD backbone files and the regulatory forms, that enables submissions to be efficiently routed to the assigned review division or the reviewer. But when they don't align, it impacts FDA's ability to automate the process. It requires additional effort, manual entry, time, and it could even result in a request for information that may not otherwise be necessary. Here we have a few frequently asked questions to our electronic submissions team. Where do I place my content? We do get this all the time, and understandably so. It can be quite confusing to people that are new to putting together an ECTD submission about where to file the various documents under. And what we do is we refer these questions to our website, where they can look at the comprehensive table of contents, headings, and hierarchy, which is an index of all the ECTD standardized headings. If it's not clear there, we also refer industry to the M4 Organization of the Common Technical Document for Registration of Pharmaceuticals for Human Use Guidance for Industry. This is an ICH document. And then finally, if it's just still not clear after that, then what we recommend is that the sponsor or applicant reach out to their FDA regulatory project manager to just ask, hey, I've looked in under the standardized headings for ECTD. I'm still not sure where to place this. Where would you normally look for this? And then finally, as many of you know, if you need it, you can always contact our electronic submissions team at esub@fda.hhs.gov. This up here is a screenshot of one of the pages of the comprehensive table of contents, headings, and hierarchy. It really goes into quite a bit of granularity on the standardized heading names for where you can place your documents. Some more questions. How do I get started with ECTD? How do I request an application number? How do I get a gateway account? So these questions and more are actually answered on our ECTD website. And you can get there, www.fda.gov/ECTD. And here at the bottom, this is the landing page, and at the bottom, there's a link there, submit using ECTD. And if you click on that, it will contain information about how to get going and answer all of these questions. going to switch gears a little bit and talk about CDER's NextGen portal. This portal has been operational for a few years now, but I wanted to discuss a few new features in the portal. They call them events that have been enabled over the last, I'd say over the last 12 months or so, that really do apply to this audience. So the CDER NextGen portal, it's a cloud-based system, and it's enabled transformation in the way CDER and industry work together. It's very easy to use interface. And the CDER NextGen portal really fits in with these different submission paths to CDER. So when you submit things electronically, there's the CDER NextGen portal, which I'm about to talk about. There's also the ESG, or Electronic Submission Gateway, and that's where you send in your ECTD submissions, or you use the ESG if you're sending in your post-market safety reports. And then there's also CDER Direct, and that's where your SPL submissions go, and I've listed here some various examples. So with the CDER NextGen portal, number one thing to remember is this is for CDER submissions only, except for DDT. DDT is drug development tools, but for everything else, it's just for submissions that are going to CDER. And you can send in a variety of things through this portal, including requesting an application number, drug shortage notification, non-ECTD submissions to Drug Master File Type 3 and Research IND. So remember, in the ECTD guidance, it has an exemption section for non-commercial IND, and that includes Research IND and also Type 3 DMF. So if you're exempt from the ECTD and you can't, and you say, hey, I cannot submit an ECTD, I need to submit in another way, you can use this portal. And this is much better than sending documents in paper and so forth. So looking at the CDER NextGen portal, what have we already done? What's new? So the portal contains capabilities to submit drug shortage notifications, pre-ANDA meetings, GDUFA 2 program user fees, generic drug controlled correspondence, drug development tools, and then these last three is where I really want to draw your attention to. Pre-assignment number. So this is how you can request a new application number if you need it. Previously, you would send an email, and it wasn't the most streamlined way to do things. Now you can do it through the portal. It's more transparent. You can track your request. There's also alternate submissions. So what we're talking about here are the Type 3 DMF, or the non-commercial IND, which includes Research IND, which includes Research IND here, which we have another icon here. Let's say we had talked about how the ECTD guidance recently received an update where it gives instructions on how you can request a waiver from the ECTD requirement. If you happen to receive that waiver and now you're subsequently sending in your submission in non-ECTD format, you can send that in through the portal, or you can send it in through ESG. So pre-assignment application number, that's one of those new events, right? So what's new? FDA added a new event in the CDER NextGen portal in 2019 for requesting an application number. And the target audience here are applicants that need a CDER assigned application number for an NDA, a BLA, an ANDA, an IND, or a master file. And the benefits here is the streamlined approach to submit and track a request for an application number. And I have a link down here if you need more information about how to start using this new process for requesting an application number. There's a link right here. It'll take you right to our FDA.gov page. What are alternate submissions in CDER NextGen? These are submissions that do not fall under the ECTD guidance, or they're exempted under the guidance, or maybe you have received a waiver from the guidance. So this could be EUAs, DMF Type 3, marketing and advertising submissions, pre-submission correspondence, applications which receive a waiver from the ECTD guidance, or medical gas submissions. So overall, the goal is just we want to provide a way for industries to send submissions. These are the ones that are not required in ECTD. We want to provide a way for you to send these without the need for paper or electronic media, especially in our current environment with COVID. We really want to reduce the burden on the industry side in terms of, assembling paper submission into binders or taking things to the post office, or we want to help you by avoiding that. That's why we've opened up this capability on the CDER NextGen portal, so you can simply submit those files right over the internet in a safe and secure manner. And then finally, there's a research IND event now in CDER NextGen. What's new here? It's for submission of research INDs. So this is a subcategory of those non-commercial INDs that are exempt from the ECTD guidance. Definitely, if you have the capability to submit an ECTD, we would prefer your research IND to be an ECTD. But if you can't do it, and since it's not required under the guidance, the next best thing is that we ask you submit it through the CDER NextGen portal. Or you can submit it through the electronic submission gateway. A few metrics on research INDs. Again, these are the ones that are coming in non-ECTD format. Since we launched the research IND option on the CDER NextGen portal, we have seen a steady decrease in paper submissions month over month. If you look at March, we were receiving, and that's when we went live with the CDER NextGen portal, 62% of these research INDs were coming in paper. And only 15% were using the new feature on the portal. And now you look at the, as of the end of July, we knocked down the paper submission rate down to 21%, which is really important overall in terms of where we're going, in terms of reducing the paper footprint, but it's really important this year with COVID. And you see that the CDER NextGen portal is where that's picking up. That's up to 54%. So now, I've talked about the benefits of CDER NextGen portal. You might be wondering, well, how do I gain access to it? So if you are an existing user, you will automatically have a couple of new event tabs available to you. One's called FDA Alternate Submission, and the other one is called Research IND. The pre-assignment one is there as well. If you're a new user, when you log on to the portal at edm.fda.gov, there'll be an option there where you can sign up if you don't have an account. The account creation process is straightforward, and you can do that definitely within the same day. You probably do it within 30 minutes. So, support for your electronic submission. ECTD and general electronic submission questions, please send them to the eSub account. If you have questions about study data submissions, the technical rejection criteria, anything surround submission of study data, please contact the eData team. And then finally, if you have any questions about the CDER NextGen portal, the address there is EDM support. So in summary, the key takeaways here, when thinking about the FDA electronic submission guidance, a couple of things. There were updates in February 2020, and if you're submitting study data, make sure you listen to my colleague Heather Crandall's presentation, look at the supporting documents that are in this presentation about the specific validations that will be used. Help us continue to improve our processing of submissions. You can do that by just making sure that when you're putting together a submission, that the submission type you choose in your ECTD publishing software is aligned with the submission type that you selected on the FDA fillable form, whether that's a 356H, 1571, or other fillable forms. And then finally, just be aware that we do have that CDER NextGen portal. So if, for whatever reason, if you were planning to submit something in paper we're planning to submit something on a physical media like a hard drive or DVD-ROM, we just want you to know that the CDER NextGen portal is out there, and it may be a preferable alternative for you to submit. So just keep that in mind. With that, I thank you very much for your time, and our team will be around here at the end of this session to answer questions. Thank you.
Hi, my name is Heather Crandall, and I am here from the Office of Business Informatics in CDER to talk to you today about the Study Data Technical Rejection Criteria, or TRC for short. So, a disclaimer, and today we are going to walk through what are the ECTD and study data requirements around the TRC. I'm also going to go through some conformance analysis that we have done internally based on the study data technical rejection requirements. So it's important to note as I'm going through this that the TRC is not yet effective. Submissions are not currently being rejected based on these validations. However, we have been running conformance analysis based on it on submissions we are currently receiving. I'm also going to go through some of the top error reasons we're seeing for 1734 and 1736, two of the study data technical rejection criteria validations, again based on the conformance analysis. And with that, go through how some of the FDA tools, particularly the Study Data Self-Check Worksheet, can assist sponsors with avoiding these top error reasons. So, what is the purpose of the ECTD and the study data requirements, these standardized data requirements? So part of it is that by submitting in a standardized format, it allows for the data to be reliable, easily accessible, to improve efficiency and consistency of review divisions. And that's critical for FDA's overall review process. So where these study data technical rejection criteria validations are coming from are a couple different guidances. And there's one guidance known as the 745A guidance. And branching off of that are two guidances, one the ECTD guidance, and the second one, the study data guidance. So the study data guidance actually states that for NDAs, BLAs, and ANDAs, for studies submitted in those application types that start after December 17th, 2016, and for studies submitted in commercial INDs that have a study start date after December 17th, 2017, those particular studies must conform to standards in the FDA Data Standards Catalog. And it's important to note, I said earlier that the study data technical rejection criteria validations are not currently effective. Submissions are not currently being rejected based on them. However, these guidances are in place, and even though the validations are not yet effective, sponsors are still obligated to comply with the standards as listed in both the ECTD guidance and the study data guidance. So getting into the conformance analysis, this slide shows an overall trend of the failure rate we are seeing based on our conformance analysis across CY 2019 and the first half of CY 2020. You can see overall across that whole time span, the failure rate has decreased in our conformance analysis. However, if you narrow down to just CY 2020, Q1 and Q2, you can see that while NDAs and BLAs have also decreased over that smaller time frame, their failure rate has decreased. For commercial INDs, there's actually been a slight uptick in the failure rate for our conformance analysis over Q1 to Q2 of CY 2020. So getting into some hard numbers on this, I know there's a lot of numbers on this particular slide, so I'm just going to draw your attention to a couple of them. So what we did is for the BLAs, NDAs, and INDs, we broke it out by quarter, and we looked at what's the total number of submissions coming into these particular application types, whether or not it has study data, just to get a feel for what's the overall volume look like. And then from there, we narrowed it down to say, okay, so from that overall volume, how many of these submissions have either study data or a study report in them, somewhere in Module 4 or Module 5. And then we narrowed it even further to say, well, the TRC validations do not apply to every subsection of Module 4 and Module 5. So based on these subsections it does apply to, and if you're not familiar with those subsections, that's listed out in the validations themselves, as well as the self-check worksheet and the other documentation around the TRC validations. But we narrowed our scope to look at just submissions that have study data or study reports just in those applicable sections that the TRC validations will check. So that even narrows it down a little further. And that's what you get in row C. So then from there, we ran our conformance analysis. And I'd like to bring your attention to a couple numbers. So we see a high volume of commercial INDs with error 1734. And I'll get into, in the next slides, I'll get into a little bit of exactly what we're seeing in which module, so that way you have a better idea of that. But in general, we're seeing a very high number in INDs for error 1734. Overall, the failure rate that we're seeing based on submissions that have study data or study reports in TRC applicable sections, we're seeing almost 56% of commercial INDs that fall under that narrowed category would throw an error for one of these two validations. For NDAs, BLAs, we're seeing around 35% if I average those for the same grouping here. So those aren't small numbers, and it's something for sponsors to keep in mind moving forward as you're putting together your submissions. So what are the error reasons that we're seeing? And let's start with 1734. So validation 1734 is looking for a trial summary data set with information on the study start date for studies in the required subsections of M4 and M5. So our number one error reason that we're seeing across NDAs, BLAs, and INDs is a missing TS file where we would expect to see one. And there is documentation that there's a link to at the end of this presentation that gives a whole table about CDER and CBER's expectations for when a ts.xpt should be present in a study, based on the study start date, the type of submission, which subsection of Module 4, Module 5 it's being submitted to. So that's a very useful resource. So, and this missing TS file, this includes both full and simplified TS files for those of you who are familiar with that particular terminology, and I'll explain that in a couple slides for those of you who are not. For the missing ts.xpt file reason, we broke it out a little further with this bar graph that you see to show a breakdown between NDAs, BLAs, and commercial INDs, which module, either non-clinical, Module 4, or clinical, Module 5, we are seeing these missing ts.xpt file errors in. And as you can see from this graph, the majority of what we're seeing for these errors is coming in non-clinical sections in INDs. We're also seeing more in non-clinical sections for NDAs, but the majority are in the non-clinical IND sections. And the number one reason we're seeing for this, when we dug into those non-clinical IND numbers, is that studies that only have study reports in that particular submission are not including a ts.xpt file in the study. So there could be study data for those studies in other submissions, but the TRC validations are being triggered by the presence of a study report. And these triggers can be found in the TRC documentation with the expectations by CDER and CBER for when the presence of a ts.xpt file would be expected by either center. And that breaks it down by application type, section the study is being submitted in, and the study start date. And particularly for non-clinical studies, the triggers for the validation are the presence of an XPT file or the presence of a study report with one of 3 particular file tags. And those file tags are listed out in the validation documentation. So you can find those particular file tags there. So if you are submitting a study in a non-clinical section with a report tagged as one of those, then the TRC validations would trigger for that submission and for that study, and a ts.xpt file with a study start date would be expected for that study. We're also seeing a lot of this come in the repeat dose toxicity section, module 4.2.3.2. So you can see from the numbers, a lot of these study reports are coming in there. However, it's coming in all applicable non-clinical sections. We are seeing this issue. And like I stated previously, the TRC validations are not yet effective. We are not currently rejecting based on them. However, we are encouraging sponsors to submit ts.xpt files to be in conformance with the 1734 validation before they become effective, and also that there is expectation that sponsors will meet the study data guidance requirements, even though they are not yet being validated on. Sponsors are still obligated to follow these standards as listed out in those guidances. And here are a couple important reminders about the dates that are in for these send requirements that are in the data standards catalog and the versions of send attached to these dates. This also is one of the places where the self-check worksheet can assist sponsors with adhering to this expectation, because there is a particular question in the self-check worksheet that asks if XPT datasets other than the ts.xpt file are included. And you can check off yes or no. However, if you stated that you are submitting in non-clinical, it also highlights a question about are study files tagged as preclinical study report, legacy clinical study report, or study report body. And those are the three file tags that act as a trigger for the TRC validation in non-clinical sections. And from there, based on whether you say yes or no, sponsors can continue to fill out the self-check worksheet, saying whether or not a full or simplified TS is required for their particular study. Filling out, the study ID, the study start date, as would be expected. So here are a couple examples of a simplified TS. So what a simplified TS is it's a pared down file with just, at minimum, these 4 pieces of information for the validation to find the study ID and the study start date to help validate 1734. And there are 2 examples here, one with a study start date filled out and one with NA in the TSVal NF field. And there's a link to the Study Data Technical Conformance Guide, which lists out requirements and expectations around filling out that TSVal NF field and when it would be appropriate to do so. So, the second most common error that we see in 1734 is a mismatch of the study ID. And that is a mismatch between the study ID in the STF file as part of the ECTD structure and the study ID in the ts.xpt file that's part of the study data. So there are actually 2 ways that sponsors can match this STF study ID, either with the study ID in the TS file or with the parameter of SPREF-ID in the TS file. So here's a quick example of that. So in the, this is a mock-up of both part of an stf.xml file as well as a ts.xpt file, and the STF study ID is listed as S107. However, in the ts.xpt file, the study ID is listed as PQR456. So in this example, the SPREF-ID parameter has been utilized to fill out S107, allowing that study ID match to be made. And again, in the self-check worksheet, there are examples and questions around matching of the study ID, and there's actually logic built into the self-check worksheet where it will automatically fill out yes or no based on what you type into several of the fields, asking what is the study ID for this particular file, the STF, the TS, etc. And also I wanted to note that there's no expectation that the self-check worksheet would be submitted with a study. It is for sponsors' information only. This was created and put out based on feedback that was received from industry, and this is a tool for sponsors to use if they choose to before submitting their studies in their submission. So there's no expectation around a self-check worksheet being submitted with a study, just so you are aware. So the top error reason then for 1736. 1736 is looking for particular data files if a data set is determined to be standardized. So for send, it's looking for a DM data set and a define.xml. For SDTM, it's also looking for DM and define.xml. And then for an ADAM dataset, it's looking for an ADSL dataset and define.xml file. So the number one reason we're seeing for 1736 error in our conformance analysis is a missing define.xml file. We're also seeing missing DM files, some ADSL files, but the number one reason is a missing define.xml file where we would expect to find one. So also in the self-check worksheet, depending on what you fill out, these two examples happen to be for clinical sections, but also non-clinical could be populated. It asks if the files that 1736 would be looking for, DM and define, ADSL and define, are included in the submission. So it's simply a yes or no checkbox. And that would act as a reminder for sponsors of, have you included this in your study, in your submission? So some documentation around the technical rejection criteria for study data, as well as the self-check worksheet, can be found on this FDA webpage. In summary, overall conformance for these two errors has been increasing. The failure rate has decreased over time, especially for NDAs. We're seeing a slight uptick across the first 2 quarters of 2020 for INDs. And while the validations are not yet being rejected on, it is still expected and sponsors are still required to conform to the standards that the guidance is listing. That expectation is still there. So here are some references.
Great. Thank you so much, Heather, for your presentation, and we appreciate how practical it is, and the guide is so easy to use. So thank you for sharing that, and thanks for staying on to take some questions. For our audience, if you want to put your questions in the Q&A pod, we actually also have Ethan Chen joining us to answer questions. He is the Director of the Division of Data Management Services and Solutions under CDER's Office of Business Informatics. So please welcome Ethan He's a great resource for these. And our first question is actually going to go to Ethan. So, is there a plan to upgrade the next-gen portal? For example, upgrade the file size allowable more than 45 megabytes and also allow the uploading of a folder of files instead of just individual files?
I hope you can hear me. This is Ethan, and the answer to that one is we are currently only allow receiving of the single files, and we are not able to receiving the folder when you submit the information via the CDER NextGen portal. We are aware of the request, and those will be considered for the future release. And you will be welcome to sending your additional enhancement requests to the email address of edmsupport@fda.hhs.gov.
Okay, great. Thank you, Ethan. And our next question is for Heather. So Heather, the validation criteria 1734, 1735, 1736, and 1789 still do not have effective dates. Is there a plan for them to be effective anytime soon?
Hi, yes. I hope you can hear me clearly as well. So information will be posted on the FDA eCTD webpage and in the validation documentation at least 90 days prior to these validations becoming effective. So keep an eye on the eCTD webpage and the validation documentation that would be updated accordingly. Thanks.
Okay, great. Thank you, Heather. And our next question is for you as well. Are companies supposed to use the NextGen portal for all types of application number requests, for example, INDs, NDAs, etc.?
Yeah, so the NextGen portal can be used to request pre-application numbers for all application types. NDAs, ANDAs, INDs, BLAs, and master files. So you can use it for all application types.
Okay, great. And another question for Heather. Where can someone go to get updates pertaining to eCTD when they occur?
So updates to eCTD requirements for FDA would be available on the FDA eCTD webpage. So you can check that webpage, and we post important notices. We update documentation linked to that webpage, and you can see it all there.
All right, great. Thank you, Heather. And our next question is for Ethan. Can you use the CDER NextGen portal to get a CBER application or CBER master file pre-assigned number? So can you explain that a little bit?
Portal is currently available for all CDER applications to request a pre-assigned number. They are not available for any of the CBER applications.
Okay, great. And we have another question for you, Ethan. When requesting a pre-assigned application number through CDER NextGen, how long does it take to obtain the application number? For example, if you submitted at 7:30 a.m. on Monday, when would the sponsor obtain the assigned number?
The application number assigned.
Thanks, Ethan. Can you just go ahead and repeat that?
typically within a day you will get the pre-assigned application number here. Can you hear the answer?
Yeah. Okay, great. And our next question is for Heather. So Heather, for studies that were started after the electronic submission rule effective date, can we continue submitting the clinical study reports in the legacy format?
Yeah, so if the study in that electronic submission started after the study data guidance requirement date, then that study should be submitted in the appropriate standardized format. And if you have questions about a particular study, you can contact the eData team at edata@fda.hhs.gov.
Great, thank you so much, Heather. And another question for you. Is there a requirement that forms be electronically signed? And if they aren't signed, what would be the consequences?
So for electronically signing forms, it's recommended they be electronically signed and that after they are electronically signed, the form remain in a fillable form format. And that's because there is validation, I believe it's ECTD validation number 7 on the validation code that checks for specific forms to be fillable during a submission. So if you have specific questions or concerns around signing your forms electronically, you can contact the eSub team at esub@fda.hhs.gov.
Okay, great. And another question for you. How do we request a pre-assigned number through ESG? Is it via a cover letter with the typical information you would use in the prior email format?
So pre-assigned application numbers cannot be requested through the ESG. On the FDA ECTD webpage, there is a link to steps for submitting in ECTD format, where there is a webpage for how to request an application number for CDER applications. You can do this either via the NextGen portal or an email, and there are details on this webpage about information that should be submitted when requesting this application number, depending on the type of application number you are requesting. So you can find that all on this webpage.
Okay, great. And our next question is for Ethan. So Ethan, in using CDER's NextGen portal, when you're submitting a research IND, does it go into pre-assignment first to obtain a number, and then is it submitted under a research IND?
The answer is yes. You do need to get a pre-assignment number for the research IND, then you submit via the portal, and that would be the preferred way from the CDER NextGen portal.
Okay, and we actually have a follow-up to that question. Are pre-subs and emergency use submissions submitted under the FDA alternate submission?
Yes, they can submit via the portal.
Okay, great. And one more follow-up on that same topic. Do you have a preference of whether they should use ESG or NextGen portal? as far as one over the other?
Also can submit either way via the ESG or NextGen portal. We certainly prefer to using the CDER NextGen portal.
Okay, great, thank you. And we have a question for Ethan also about, do you have a quick link for drug shortage reporting in the NextGen portal?
The drug shortage reporting is just updated, and the new version of drug shortage reporting is available. The link is available in the CDER NextGen portal.
Great, thank you, Ethan. Our next question is for Heather. Although TRC 1734 through 1736 are not in full effect right now, will sponsors be notified or alerted if their submission fails the validation for these specific rules?
So FDA is not currently validating incoming submissions for validation 1734 and 1736. So sponsors would not be notified based on these.
Okay, great. Thanks, Heather. And we have another question for you. For a commercial IND, the sponsor would need to submit the following study data standards for SDTM, for example, data sets in Define XML, and the ADAM, a DSL and Define XML. Does this imply that these are the only data domains that need to be submitted alongside the clinical trial report?
No. The specific files that are verified in the study data technical rejection criteria validations are a basic check to see if studies are coming in with standardized data when that is required by the study data guidance. Standardized data sets should follow the full requirements for the standards listed in the data standards catalog, including for which domains should be included.
Okay, great. And we have another question for you, Heather. Whenever there is an update required to a particular study report in the next submission, should these be brought in new or should they be replaced?
For all ECTD documents, but particularly for the study report, since that's what the question is asking, if a previously submitted document is being updated, the sponsor should use the appropriate lifecycle operator, be it replace, append, or delete. So if you are updating to replace, then it would be appropriate to use that lifecycle operator in your follow-up submission.
Okay, great. And another question for you. Is FDA rejecting applications with study data that do not meet the criteria described in this presentation? If a sponsor is unable to meet this criteria, how should they proceed?
FDA is not currently rejecting submissions based on the study data technical rejection criteria because they are not yet effective. If you have questions about meeting the criteria for a particular study, please contact that eData team at edata@fda.hhs.gov.
All right, great, thank you. And if you guys want to take a look at some of the questions coming in, our next question is going to be for Ethan. Is there another electronic portal for medical device submissions similar to the CDER NextGen portal?
that you will need to contact CDER and to see what is their plan. Currently, the CDER NextGen portal is only for CDER use.
Okay, great. Thank you. Another question for Ethan. Will the NextGen portal provide confirmation for receipt of submissions, rejection, or acceptance notifications?
Currently, the CDER NextGen portal will send a receipt email after submission is being submitted to FDA.
Okay, great. And another question for you, Ethan. Is secure email needed to use CDER NextGen portal?
When request an account in the CDER NextGen portal, you will asking for a two-way authentication method, which is an email or phone number. Secure email address is preferred.
Okay, great. And thank you both for coming on and presenting and answering so many questions from our audience today. That's all the time we have for questions. And with that, we're going to go ahead and take a break and reconvene at 12:45 so everyone can go ahead and refresh and check their email. So again, we're going to start again at 12:45, and our next speaker will be talking about an overview of post-approval chemistry, manufacturing, and control, CMC. And we'll see you back at 12:45.